The record number of opioid deaths in Kent County and the nation is nothing less than tragic. But the deadly crisis has had an unexpectedly life-affirming result. More organs are available more than ever before. 24-Hour News 8's Barton Dieters has been talking with people impacted by transplants on both sides of this phenomenon, and he has our story all new at 6.
Well, Brian, since 2007, the number of opioid deaths in Michigan has more than tripled. Last year was also a record year for transplants. Those numbers do share a bittersweet connection.
There's a part of my son helping them live.
Just over a year ago, Lori Yoke Anderson discovered her 33-year-old son unconscious in his bedroom in Traverse City. Despite years in recovery, Ryan Anderson was overcome by his addiction to opioids, including Vicodin. He died on February 1st, 2017. She decided to honor his wishes to donate his organs and recently met two men who received his heart and lungs.
That allowed me to take my pain out of me right now and look forward for their happiness. That was a wonderful gift.
Ryan was part of the state's grim growth industry. For the last 2 years, state and national statistics show an annual increase in deaths of about 20% after jumping by more than 50% in 2015. Ryan's organs and tissues have helped dozens of people, also part of that trend that gives hope to tragedy.
Last year, about 16% of all of our donors came from a drug overdose. Since 2014, that percentage has doubled.
But as the number of organs available grow, so do the number of people needing organs, so wait times have not decreased at this point.
What we do see, though, are fewer people dying waiting for an organ transplant. Those numbers are coming down, which is very encouraging.
Organs from opioid overdoses are listed as high risk, and recipients must agree to the risk of accepting these organs.
The increase in the risk is less than a 0.1% increase from accepting a standard criteria donor kidney.
Michael Inglesby is a transplant surgeon at University of Michigan who says about 1/3 of all organs transplanted are qualified as high risk.
Turned down, if we didn't use those organs, a lot of people would die.
The risk of turning down an organ is much higher than taking one because you might die before another is available. Scott Campbell from Caledonia received a high-risk heart in December of 2016.
It really wasn't a hard decision for me to accept that heart. I feel 100% better. I guess I've never realized how good I could feel until I did get my heart.
He says he will always appreciate the gift he was given by another family in the depths of despair.
I'm going to be able to walk my daughter down the aisle when she gets married and see my grandchildren when my son and daughter-in-law have children. Those kind of things that I'm sure would have never happened if that wasn't for my donor.
In 2012, I received a high-risk liver and transplant, and now I'm doing just fine. Now, we'll have links at woodtv.com that can lead to resources for dealing with addiction and tell where to sign up to become an organ donor.
A grim growth industry. So true.
Yeah, it is. It's that juxtaposition, that kind of duality of, on the one hand, all this tragedy, on the other hand, these people who get another chance at life. That's kind of one of life's strange things.
Bittersweet indeed.
Yeah.
Thank you, Barton.